Hi children, good morning. Welcome to our next class. In last class you learned about the first aid to be given for a burn and for a fracture. This all you learned and you are ready now to help for others. And before knowing some other accidents and what type of treatment, first aid to be given for such accidents, we'll see today's class. So have you ever bitten by a snake, or have you seen the person bitten by a snake? Yes. And the situation, if any person bitten by a snake, and if you see the situation around him, will be very panic, and the person also, the victim also feels so panic. Yes. So what to be done in such situation? How to reduce the tension in that victim, and what first aid to be given you are going to learn in today's class. So in your block 11 S3 you are learning about first aid for a snake bite. First aid for a snake bite. What first aid to be given for a snake bite, we'll see now. First thing, make the person to be calm and don't make any panic situation around him. Give some encouragement to the person who is bitten by a snake. You have an activity in S3. In your volume book, an activity is given. Stepwise procedure is given there. What type of first aid to be given to a victim who was bitten by a snake. And you can make a skit whenever physical class starts. One should act like a person bitten by a snake, and the remaining 4 members should help him and should give the first aid for the snake bitten person. And before doing this skit, you should understand that what type of treatment to be given for a snake bite. First thing, as soon as we came to know that the person has bitten by a snake, immediately we must call to the hospital. Immediate medical help is needed. Immediate medical help is needed for a snake bite. Till the medical help arrives, till the victim moved to the hospital, you should make the person to be calm. Make the person to be calm and give some encouraging words. Give some encouragement. Give some encouraging words to him or her. Nothing will happen. Don't worry. Like that, some encouraging words you must tell to the victim. And the next one is, you should apply some pressure bandage above the bitten area where the snake bitten. Above that area, tie a pressure bandage. Tie a pressure bandage, or you can use a splint also. In fracture lesson you learned what's the meaning of a splint in yesterday's class. While giving first aid to a fracture, you had seen what's the splint is. So you can use the splint even for snake bite. And also, if the snake bitten on a hand, you see the bitten area, and above the bitten area tie a pressure bandage. How these two things are helping means, it helps not spreading. These two actions will help by not spreading poison. Poison will not spread into other parts of the body when we tie a pressure bandage. Not too tightly, just tie a pressure bandage, how far it can stop the blood flow, so that it will not reach to the poison will not reach to the other areas. Generally, when you see any snake, you should be calm and move from that area. Instead of that, catching the snake or teasing, these things makes the snakes to get irritated and they may harm to us. Until unless we won't harm them, they are not going to harm to the people. So this you should keep in mind. Never tease the snakes or catch the snakes. And the next one is, there are different types of snakes in our country. All the snakes are not poisonous at all. Most of the snakes are non-poisonous snakes we have in our country. Most of the snakes are non-poisonous. But by seeing at the bitten area, we cannot find out whether the bitten snake is poisonous or non-poisonous. That's why whatever it may be, if the person feels that he was bitten by a snake, immediate medical help is required. Immediately call to the hospital. As possible as early, move the victim to the hospital. There, antivenous injections doctors will give and they will save the life of the victim. And don't waste the time near the home and don't make the person to be panic. Give some encouraging words. Make him to be calm and apply a pressure bandage or give a splint. This helps by not spreading the poison to the other parts of the body. The same you are going to do. You already did an activity in S3. That's what the first aid tips they are giving you. You read these 4 points. You will understand what type of first aid to be given to a snake bite. Okay. And see the pictures. In the first picture, what they are doing? Applying a pressure bandage. If the snake bitten on leg, above the bitten area, he is applying a pressure bandage. What for he is doing? To stop the spread of poison. And next one, a splint prevents the snake poison from spreading. With a wooden plank he is making a splint and giving support to this leg. And in the third picture, if bitten on the hand. If bitten on the hand with a splint is giving support for the person. Understood, children? Now you will be able to save a person if he is bitten by a snake. What to be done, what first aid to be given, you understood clearly, right? Now see, how can you avoid being bitten by a snake? First thing, you should not bitten by a snake. How can you avoid this? You are not going near to the snake wantedly. By mistake, if you see a snake, you just be calm and slowly move from that area. Don't tease or don't catch the snakes. So what you can write for first question answer? Do not catch or tease the snakes. Do not catch or tease the snakes. When you won't do these 2 things, they will never bite us. Understood, children? And the next question, if you would take the same time to move the victim to a hospital or get medical attention to reach the victim, what would you prefer and why? If it would take the same time to move the victim to a hospital or get medical attention to reach the victim. One thing is to take the person to the hospital is better or giving the treatment at home is better. Which one do you feel and why? Better to make the person to move to the hospital. because the poison should not spread to the other body parts. Okay. And the next one, should we follow the first aid steps for a snake bite even if we are not sure that patient has been bitten by a snake or not? Whatever it may be, whether the poison snake or not, whether it is a snake or not, but something has bitten him. When the farmers go near their field at night time, they cannot see because full dark will be, and they cannot identify what has bitten, but something bite on their legs and they may feel pain. So in that time also better to give the first aid. First aid is better. Beforehand, if we give first aid, applying pressure bandage or making them calm, these all are no harm by following these first aid tips for any bite. It may be insect or it may be poison snake or it may be non-poison snake, whatever it may be. Instead of taking him to the hospital is better, or getting medical attention to reach the victim. Medical attention may reach to the person, but injections and all may not be available to any person who knows the first aid also. So better to move the victim to the hospital as possible as soon. Understood, children? Now we will see what type of first aid to be given for a person in unconsciousness. When a person is in unconsciousness, what type of first aid to be given? That we'll see now. Children, have you ever seen a fainted person? Yes? Before going to faint, they feel so dizzy. And what type of first aid to be given to a person who fainted? That we'll see in our S4 block level. And before knowing that, we'll also see the keywords which are there in S3 and S4. So your S4 is for first aid for fainting. This both the blocks keywords are, and before lesson, poison, P-O-I-S-O-N, poison, and splint, S-P-L-I-N-T, splint you already know, conscious, C-O-N-S-C-I-O-U-S, conscious, T-I-L-T, tilt, tilt, recovery, R-E-C-O-V-E-R-Y, recovery. So these are the keywords in both the blocks, children. You must learn these spellings well so that you can do your worksheets well and you will understand the content good. So what type of first aid to be given to the fainted person? Actually, why the people will go for fainting? What's the meaning of fainting? Fainting means blood supply will become less to the brain and people will go for unconsciousness. Before going to the fainting, they'll understand that it becomes dizzy for them. All like moving, they feel the sensation of moving around them, the things and everything feeling like moving, called as dizzy. So they'll go to the dizzy condition and they'll come to know within 1 or 2 seconds that they are going to faint. So in such cases, what we are supposed to do? First thing, if they are going to faint, you must make them to lie down on the floor. You can do this activity in S4, your volume book. An activity is given and a step-by-step process as explained here, how to help a fainted person. First thing, if the person knows he is going to faint, make the person to lie down on the floor by keeping the head backside. Lie down on the floor, make him to lie down by keeping head back. By keeping the head backside, tilt the head to backside. Why to tilt the head backside? Keep the head backside means so that the tongue can prevent. It stops, the tongue cannot stop the passage of air. When the head is backward, the tongue cannot prevent the passage of air. So to pass the air easily for breathing, the head should keep it backward and make the victim a side. Tilt the person to a side. Make the person to a side. Make him or her to lie down to a side, either left or right side. Make him to lie down. This position, making the victim to tilting aside and keeping the head backward, this condition, this position is known as recovery position. Recovery position. Why to keep the victim in recovery position means when he keep it head backward, then the passage, the tongue cannot stop the air passing to the lungs, so that he can breathe easily. That is one thing. And if the person feels that dizziness, immediately ask him to lie down and ask him to raise his legs up. Raise the legs up. So that by lying down and raising legs, make the blood flow more to brain. So the reason to be fainting, for fainting reason is flow of blood becomes less to the brain. So more blood to flow to the brain, we can make the victim to lie down and raise his legs up. So this position helps to pass the blood flow more to the brain and there is a chance to reduce fainting. If the person already fainted, then how we must know whether the person fainted? When he goes unconsciousness, he cannot talk and he cannot look at you. Then what should you do immediately? You must check his breathing. First thing you should do, check the breathing of the fainted person. How can you check the breathing of the person? Look at his chest raising and falling. Raise and fall of the chest you can observe, and you can check the breathing of the victim. And you can also keep your finger in front of the nostrils of the victim and you can check his breathing. And one more thing, keep your cheek near to the nose of victim and warm air will touch to your cheek so that you can check the breathing of the victim. So these all are the different steps. And as a part of first aid for a fainted person, first you check the breathing of that person. And then make him to tilt aside and then keep his head back and bring him to the recovery position. This helps to give some sort of relief to the victim. And immediate medical help is required in fainted conditions. As possible as give the medical help to victim. So these are some of the tips to be followed if any person fainted near your neighborhood or in your school, your friends or anyone. So these all the steps before you don't know. Now you are reading so you can understand and help to anyone. So as a part of your activity, in page number 18, different steps are given. For the medical help, what you are supposed to do? You should call 102 or 108 for ambulance. and nearby hospital numbers also always keep in handy, and so that you can call to the hospital and make the victim to move the hospital very quickly. Okay, so first picture you see, checking for breathing. First he is checking for breathing when a person went for unconsciousness. And the other one, recovery position, made the victim to be in recovery position. Recovery position is nothing but tilting the person to a side and keeping the head backward. Understood, children? Now see, how can we check if a person is breathing or not? Just now I told, check the person breathing by seeing the chest part raise up and fall down, raising and falling of chest. By seeing this, we can check the person breathing, or else by keeping the finger in front of nostril, we can check the breathing, or by using our cheek, we can check the person breathing. So anything you can write as answer for first one. And second one, why is it important tilt the head backward if a person has fainted? Just now we discussed that this tongue cannot stop the passage of air when the victim head is backward. Okay? So that can you write? Tongue cannot prevent passage of air. Tongue cannot prevent passage of air. So write these answers in your own words, children, what you understood. Okay. And the last one, if an unconscious person need to be shifted to the hospital, how should he or she be made lie down on the stretcher? So you gave a call to the hospital ambulance came, and how you had to make the person to lie down on the stretcher? You already know, he should tilt to a side, head backward. What we call that position? Recovery position. So third answer you can write this. Keep the head back and tilt the person to a side, called as recovery position. So the victim should be in the recovery position on the stretcher before moving to the hospital. Understood, children? So by this, in your block 11, you learnt different first aids to be given for burns, fractures, and snake bites and unconsciousness. For all these different types of first aids you learnt, and keep this in your memory and help to others so that it will be very useful in your day-to-day life. And your today's homework is complete page 17 and 18 in your volume book. Page 17 and 18 complete in your volume 2. That's your homework, children. Thank you.